the Hormone Café. I'm Dr. Pederson. I'm a holistic OBGYN, and I specialize in holistic women's health and fertility. And today I have with me our PA, our Physician Assistant Sierra Wolfe. And the reason that I'm so excited to have her is because Sierra specializes in holistic male fertility. Because oftentimes there's not a lot of great places for men to go, because sometimes your primary care doctor doesn't really know anything about your fertility, and urologists are not always amazing when it comes to fertility. So Sierra's kind of found a niche where she can really help men. So things that we're going to talk about today are: how do you test sperm health? How do you actually collect a semen analysis? What does a semen analysis even tell you? And then what are some of the top things that you can be doing to improve your fertility if you're a guy? So if someone comes to you and they're like, how do I test my sperm? What do you tell them?
So in most clinics, they have the guy go into like a closet in the clinic and make their sample on their own. But the WHO6 guidelines in 2021 actually say that you make a better sample through intercourse. So we have our guys go home, have intercourse with their wife or with their partner with a special sterile condom that has no spermicide in it. And they pour it in a little sterile collection cup and they bring it to us and we test it in our lab.
So it's kind of awkward, maybe, but not like horribly bad.
It's better than how they usually do it. They got to do it at home, not like in this weird room where that's how it's typically done. So I think it's a better method, a little more comfortable. And generally, guys tend to be like, "Oh, thank goodness, I got to doing it the natural way."
Yeah, and then they bring it into us, and then we do semen analyses in house, and then. What does a semen analysis tell you? Like, why would you even do a semen analysis?
So first of all, semen has the fluid part and the cells part. And so you could be producing a semen but not actually have any sperm in it. You wouldn't even know because you can't see them with the naked eye. And so we look to confirm, do you have sperm? How many sperm do you have? Are they moving? Are they moving enough? And what do their shapes look like? So what we call that is morphology. Morphology tells us how many heads are there, how many tails are there. Is the head big? Is the head small? And what that is kind of, it tells us what the DNA is like. So you hear DNA fragmentation. Morphology is kind of a way to check for that, because if you have two tails, two heads, you're probably going to have DNA fragmentation. So it tells us how quality is the sperm that's getting to the egg.
How important is a semen analysis? Like, where in your fertility journey or anything should you even get tested?
I always think it's good for any guy who's looking to conceive, because you never know what could be going on until you try. But definitely if you've been struggling to conceive for a few months with your partner, it could be her, but it's probably more likely 50-50. And so semen analysis is really the only way to definitively know. Guys wonder, is it me? Is it her? That's the way to find out.
And the studies show that males contribute to 30 to 60% of all infertility.
Yeah, definitely. And they're finding out now that women's mitochondrial DNA holds up better, a lot more with age than men's. The ovaries are very protected, but the testicles are kind of out in the world. And so they're a lot more susceptible to damage with age and environment than we thought.
That totally makes sense.
Mm-hmm.
Yeah, and you're right. Male health has been coming out that age does affect males more than we used to think.
It's weird.
So if you're even thinking about conceiving, it's important to do a semen analysis. It's not that hard. We teach you how to do it. You bring it into us. You totally got this. And then, okay, let's say something comes back bad or off. What are the things that you can do to improve your fertility? So like eating. What are some things that you should be eating to help your fertility as a guy?
So research shows that, first of all, things that are not good for male fertility are things like processed meat, like sausage, deli meat, and frequent high-fat red meat. Also, like high sugar diets, high processed foods, fast foods, and like high fat dairy, so whole milk. Whole milk is actually good for women, but for men, they find that sperm quality decreases when they have high fat dairy. So those are the things to avoid. What's really, really good, more than anything I found, is fish, like oysters specifically, have a ton of zinc, which is really important for sperm production and semen production. Salmon is another good one, high source of omega-3s, and the fats are used to literally form the sperm. And then kind of just, like your parents tell you, fruits and veggies, they're full of fiber and antioxidants, and oxidative stress is literally what makes the sperm have abnormal DNA.
So we're having a football tailgate, we're cutting out brats, we're introducing back oysters, shrimp and salmon, and vegetables. What about alcohol? It's something I feel like people ask all the time. Like, can you drink?
I would say, ideally, when you're trying to conceive, especially if you've been struggling, you shouldn't have any alcohol. But, in this day and age, it's kind of hard to just completely cut it out, especially with it being football season. So I tell guys, have a few drinks in the week if you need to. Don't have more than 2 in one occasion. Definitely don't have more than 7 in a whole week. So I'll have guys come and say, well, I'm having 3 beers a day. I'm like, maybe for a few months, hold off on that, because it takes 3 months to form your sperm. So you could have a whole new set of clean, alcohol-free sperm in 3 months, and then you're good.
No, you can do anything for 3 months.
Yeah, exactly.
What about caffeine?
So currently it's suggested that you should limit your caffeine to 200 milligrams a day. So that's
Men too.
For men, yeah. So that's 3 cups of coffee. That's a pretty decent amount of coffee. I don't know. For some coffee drinkers, it's like, no, I need 4. But 200 milligrams, that's the upper limit. Less is always better, but, if you need 1 cup of coffee to get through the day, that's fine.
That's good to know. Coffee's not totally off the table, as long as it's not with full fat cream.
Right? Yeah, exactly.
And then what about like smoking, weed, Zyn, nicotine?
So nicotine does, it constricts the blood vessels in your entire body, and that includes the testicles. And testicles really, really need blood flow. So if you're doing even Zyn nicotine pouches, that is going to your testicles and constricting the blood vessels, cutting off the blood supply. Obviously, if you're weaning, nicotine gum lozenges are better than smoking, but it's still going to have a bit of an effect. In terms of marijuana, we practice in Colorado, so it's kind of it's a big subject for us, but they found that, men have THC receptors everywhere in their body, including the testicles. And so it'll bind to those receptors in their testicles and basically turn off sperm production. So they find that men who frequently use some form of cannabis have lower sperm quality, lower sperm counts, lower sperm motility.
That makes sense. It's not great for you anyway. It's the testicles or no.
Yeah.
So no smoking, no weed. We're trying to wean down on that. What about temperature? I've heard you talk a lot about the importance of temperature to testicles and sperm health.
Yes. So there's a reason they hang outside the male body. Sperm prefer to have a temperature about 3 degrees lower than the body temperature. And so that's why they hang outside. So temperature is kind of the name of the game. Things like saunas, hot tubs, hot baths are no-go when you're trying to conceive. But even more subtle things like, office jobs, sitting with their legs close together, closed up for hours, that pushes the testicles closer to the center of the body and heats them up. Tight pants, long bike rides, things like that will affect the temperature of the sperm and cause them to have abnormalities. And they've done studies and found that men with poor sperm quality actually have a higher body temperature on average by about 1 degree Celsius than men with normal sperm. So some urologists will actually have men go home and ice their testicles for 30 minutes a day. to cool down the average temperature.
So ice balls.
Ice the balls.
Ice the balls. So how do you tell people to do that?
So I actually found this underwear brand called Snowballs.
We're in Colorado. We're doing snowballs.
And they come with special ice packs, 2 little ice packs, kind of testicle shaped. And it goes in this special pocket in the front. And so they put it in the freezer, take it out, put it in the pocket. They can wear it when they're sleeping, when they're driving, when they're at the office, on the computer. And they just wear the regular underwear for 30 minutes a day. They are made of 95% cotton. So that's extra good because you want to be avoiding like polyester for fertility as well. Otherwise, you could just do your frozen bag of peas or whatever you find in the freezer, as long as it's not directly on the skin, but on the outside of the underwear.
All right, ball icing, 30 minutes a day. We got it. And then what about testosterone? Testosterone clinics are very popular right now. Of course, you have patients that come to us and they're using exogenous testosterone. How does that affect your sperm health?
So it's, testosterone is needed to make and nourish sperm, but the male body is very sensitive, where if it comes from anywhere but the testicle itself, it acts as birth control. It has this negative feedback effect. It'll shut off production if it comes from any external source. So men will come and be on testosterone replacement because it was low. I'll do a semen analysis and they don't have any sperm. So they have to wean off of it and then, use other means to try to increase their testosterone production.
Which is very important. There's other ways that we can get your testosterone up without taking testosterone.
There are.
Because it is important for it to be high. We want you to feel good, have energy, have high T. We just can't supplement you with testosterone.
Correct. It's like how female birth control is estrogen and progesterone. Well, same thing with men. Testosterone will shut it down.
Makes sense. And then what about exercise?
Exercise is good for everyone. It cycles through all the toxins, keeps you regular. Specifically for testosterone, strength-based exercise is most important. The lifting, so like men will take testosterone to build bigger muscles. Well, there's a link with that. So anything that has resistance is important. Cardio is important for endurance when having intercourse. So I usually say a combination of both is important.
Strength, cardio.
Strength and cardio. Not too much of one, not too much of the other. Good combo of both is super important.
What about biking? Is it true that biking is bad for your testicles?
So traditional bike seats tend to be pretty uncomfortable for men because it kind of crowds the testicles. They do have special bike seats that have a little special space for the testicles, so they're better, but they still find that, any prolonged biking, anything longer than an hour, is associated with lower sperm counts and quality. But I have guys who like to train for triathlons, and so I tell them, get your special bike seat, and then ice your testicles afterwards, because again, they're just being pushed up against the body for that hour. So just counter that higher temperature with a little bit of a cooling session after if you have to bike.
That makes sense. That's a good idea. Yeah, Pelotons. Just try to keep workouts less than an hour.
Exactly.
Or do cooling after.
Yeah.
That makes sense. What about other things like stress, sleep? Does legitimately affect your sperm quality? How important is that?
Absolutely. Yeah. So they've done studies on male college students where they checked their testosterone, had them not sleep for a night, and then checked it in the morning.
Only college students would sign up for that.
Exactly. And their T decreases by 50%, missing one night of sleep.
Wow. So it's huge.
The reason for that is super, super fun fact. I love telling guys this because it's crazy, but guys are probably like, yeah, this always happens. But when a guy sleeps, that's when you have your blood flow and nitrous oxide production, which dilates the blood vessels. So men physiologically, naturally will get erections in their sleep in order to get blood flow to the testicles. It's a normal thing. But if they're really stressed, if they're not sleeping well, if they're waking up, tossing and turning, if they have sleep apnea, their blood vessels will constrict because of adrenaline, and it's going to cut off blood flow to the testicles and to the penis, which is needed to, keep things going, keep the blood vessels active and clean.
Which would hurt sperm quality over time if you're not getting blood flow to your testicles.
Yes, and would cause erectile dysfunction as well during the day. So that is, a tough thing is guys carry a lot of weight on their shoulders, and it's something that's not always talked about. It's hard to talk about, but then it, does affect the fertility over long term if it's not addressed. So things like stress, things like losing sleep, will not only affect libido and, performance during intercourse, but the sperm themselves will be affected.
That totally makes sense. It's got to pay attention to all the parts. Y'all, you heard it here. Thank you so much. That was so helpful. Our favorite topic, men and sperm and balls. What could be funner to talk about? So things that we went over are how important is sperm health? How do you even test for sperm health? What are some of the logistics of actually doing a semen analysis? And then what are some of the things that a semen analysis tells you? And then what are the things that you can do to improve your fertility and improve some of those abnormal semen parameters that we see on a semen analysis? So easy on the bear, go ice your balls, and then get lots of sleep, lots of rest, and strength training and cardio are the takeaways. Thank you so much for joining us today on the Hormone Café. And thank you, Sierra, for being here.
Thanks for having me.
It's so amazing to talk to you like this and just have this great discussion. And then next time we'll be talking about something maybe completely different, but we're going to go into and do a session on postpartum health, postpartum care, things to look for in postpartum self-care. So stay tuned for our next episode of the Hormone Cafe.